Dear friends, how are you today? How have you been? I'm Mark Golub. I hope you're all finding ways to keep life interesting, to get through the day. And I really know that if you're alone, and especially if you're older and alone, it can be still very difficult, and I'm very sorry. I hope the end is in sight for all of us, and there are positive signs in that direction. Though I often feel the medical experts really they know very little about how this virus works. I do know that America is slowly opening up. And of course, how bizarre is it that in the middle of this pandemic, thousands of people are protesting in our streets throughout our country, paying no mind at all to social distancing. What's going to be the outcome of that? Will there be a huge resurgence of the virus? If not, does that mean it's basically come and gone? We'll all have to see. Anyway, the weather is getting warmer. Don't you always feel better on a warm, sunny day? Especially if you have a way of getting out, even just a little. And of course, I hope you're enjoying JBS and that we've been of some comfort to you and that you've enjoyed much of JBS programming. And I certainly appreciate your many emails and wonderful letters I've received from so many of you. We're all in this together. And I really appreciate your kind words. Thank you. So we're always turning to someone to learn as much as we possibly can about the coronavirus. We talk to doctors and medical experts who are on the front lines, in the field, so to speak. Those who are doing heroic, divine work in caring for those who've contracted the disease. And one of the real heroes in the Jewish world is a brilliant physician who also happens to be one of the loveliest human beings you could ever know. He's an Israeli physician who also happens to be an expert in public health care. And after serving as the Director General of one of Israel's leading hospitals, Shaare Zedek Medical Center in Jerusalem, for some 20 years, he is now the president of Shaare Zedek. I should also say that I have a most personal relationship with him. For when I had a serious heart issue while visiting Israel, lucky me, I wound up at Shaare Zedek Medical Center in Jerusalem. I was taken care of wonderfully, and I had the chance to meet and to get to know and to thank Dr. Jonanthan Halevy, and we have stayed friends ever since, and I am so pleased to introduce you to him. He's the man in the forefront of dealing with the coronavirus in Israel. Jonanthan, thank you so much for making time from Jerusalem for me and the JBS audience, and it's really good to see you again, my friend.
Thank you very much, Mark, or Rabbi Golub, as I usually call you. Thank you for your kind introduction. One minor correction.
Please.
My tenure with Shaare Zedek as Director General, CEO, took 31 years.
31 years. All right.
And then now one year after semi-retirement, becoming the president and transferring the baton to the new CEO, who was my deputy for 12 years, Professor Ofer Merin.
By the way, Jonanthan, tell our audience, what is your medical expertise?
So I'm Israeli board certified in internal medicine, gastroenterology, and health administration. I did my medical school. I'm a graduate of the first class of Tel Aviv University Medical School, and I did my fellowship in gastroenterology at Yale University up in Connecticut. So I lived for 2 years in your beloved country.
Very nice. And what's the difference now in your role as president of Shaare Zedek instead of Director General?
Well, the day-to-day running of the hospital is really in the hands of the Director General. I'm a kind of an advisor. I'm still responsible for few areas directly, like fundraising. I do a lot of clinical work. I run the liver clinic of the hospital. I participate almost every morning in the physician's rounds in the intensive care unit. All Israeli hospitals are run by physicians. You have to be a physician to be a director of a hospital in Israel, but most of them do not find the time or the stamina to be involved with patients. I believe it's a superb managerial tool when the CEO of the hospital spends 25, 30, or 35% of his time in the company of patients and families, having direct responsibility on 20 or 25 patients. I believe it's educational. I believe it's serving as a role model, how to interact with patients and with families, and also as a managerial tool in the way that you make decisions in your office and you can see what does it mean to implement these decisions by the staff vis-a-vis the patients and families.
Jonathan, Shaare Zedek has a special reputation in the field of heart and other fields as well. Most Americans only know the name Hadassah Hospital, and they don't know the name Shaare Zedek Medical Center as well as they know Hadassah. Take one moment to sort of put Shaare Zedek in context in terms of Israeli hospitals and the work that it does on a day-to-day basis.
Well, one has to remember that the owners of Hadassah Medical Center are the Hadassah Women's Organization with the 350,000 members, and of course that their presence in the States is very prominent. The owners of Shaare Zedek is an international board of directors composed of 36 people, and most of them live in Israel, some of them live in the US. So that's the explanation. But if you talk about the work, so the Greater Jerusalem metropolitan area today has a population of 1 million people, and it is being served by two tertiary care, acute care facilities. There are 3 or 4 small, very small community hospitals in the east part of the city. But the main hospitals serving as tertiary care centers are Shaare Zedek and Hadassah. Both of them have 2 campuses. Hadassah has the Ein Karem and the Mount Scopus. We have our Beit Vagan campus with 850 beds, and the Bikur Cholim campus in the center of the city, the old center of the city that we took over 8 years ago with 150 beds. So both hospitals have 1,000 beds, and both hospitals are listed among the 7 tertiary care centers in Israel. I'll count them very quickly from north to south: Rambam, Tel Aviv Medical Center, Shiba Tel HaShomer Medical Center, Bellinson Rabin Medical Center, Soroka in the south, Hadassah and Shaare Zedek. We are larger than Hadassah today significantly. You measure the scope of activity of the hospital. Among other things, the main parameters are number of admissions, number of visits to the emergency room, adult, children, and gynecological. So we are about 30% larger than Hadassah today. It has to do also with our location. We are the only major medical center in the center of the city, but it mainly has to do that during my tenure, senior physicians, very senior and prominent physicians from all over the country, some of them from Hadassah, moved to Shaare Zedek to serve as heads of department. So we have many centers of excellence that serve today as national referral centers. So I take great pride of the fact, of course, it's not the work of one man. It really took 30 years for me and many of my colleagues to turn Shaare Zedek from a small 300-bed hospital that it was in 1988 to the present 1,000 tertiary care center it is today.
By kol hakavod to you and your entire staff. One more thing about the hospital I want you to speak about, And again, I experienced this personally. I say again, I was very lucky to be brought to Shaare Zedek when I really needed help very, very badly, and I got superb help. One of the things that I was struck by, and many American Jews don't still understand this, talk about the extent to which there are Palestinian, Arab doctors and nurses who are serving as absolute equal colleagues at Shaare Zedek. The best nurse I had when I was at Shaare Zedek happened to be Palestinian. But talk about the extent to which both Jewish and Palestinian medical people create the staff that you've just described.
Okay, so first of all, I would say that all hospitals in Israel, and Israel has 29 acute care facilities, general hospitals, all of them I consider as haven for peace. Shaare Zedek is very prominent because it's in the center of Jerusalem, which is a mixed city. 38% of the population of Jerusalem is composed of Arabs, living mainly in the east part of the city and in villages and small towns around Jerusalem. And they are very well represented among the staff and patients at Shaare Zedek. I would say that among our residents, and we have around 300 residents, about 40% proportional are Palestinians, and many of them trained in one of the 6 medical schools in Israel. Others went abroad, like many Israelis, mainly in medical schools in East Europe and in Russia. And they serve, of course, as equal. Some of them rose to very senior positions. The head of chest surgery in Shaare Zedek until recently, until he went to run a hospital in East Jerusalem, Dr. Maher Dib, is a Palestinian. The head nurse, the head male nurse of our very elaborate department of neurosurgery is Muhammad. And his deputy is a settler, a woman that covers her head, a settler that lives in one of the settlements around Jerusalem, and they work together harmoniously. So among our 1,500 nurses, there is a representation of about 25% of Arab nurses, males and females. So I really consider the hospital as haven for peace.
I love the way you describe it. And I've told our audience before, when I was at Shaare Zedek, I became very good friends with a Palestinian family whose mother was in the cardiac unit as well with very serious heart problem. And they were there, they were very, very worried, and she got better and better. And when it came time for me to leave Shaare Zedek and go back to the hotel that my wife and I were staying at, it was a Palestinian who said, my cousin will pick you up in his cab and take you. And when you talk about the extent to which your hospital symbolizes and in some way is a haven of peace, I wish people understood that Israel wasn't this apartheid, anti-Arab, anti-Muslim, anti-non-Jewish state, but that it is a country that is doing its best to really live up to its vision. And its vision it is a country for the Jewish people in which anyone who wants to live with the Jewish people in peace is welcome to be a complete and full citizen. And Shaare Zedek in many, many ways symbolizes and concretizes that vision. And it says a great deal about the ethic that you've created at Shaare Zedek. So kol tuv to you, kol hakavod to your entire staff. And it's a wonderful, wonderful. So listen, I only have a million questions I want to ask you. And I want to hear your take on some of the controversial issues surrounding this pandemic. Where are you these days, today, in terms of the coronavirus at Shaare Zedek? Was Shaare Zedek ever overrun? Were you able to really deal with whatever number of patients came to the hospital. It's not simply, I want to know where you are today, but take a moment to describe how over these last couple of months, Shaare Zedek has experienced and dealt with the coronavirus.
So maybe I will start with the state of Israel, giving some compliments to our Ministry of Health. Although they are being praised all over, but they are also being criticized. That's mostly natural. But I would say that they closed the borders in early March. You know that Bibi Netanyahu, our prime minister, as a gesture to your president, to President Trump, and as you know, President Trump is a great friend of the state of Israel and is friendly with Bibi. We delayed closing the borders to the states by 3 days because we were asked by your president, and all the other borders were closed, definitely those from China and the Far East, very early in March, and the borders for Europeans and for Americans few days later. And
Why did the president ask the Israeli prime minister to delay?
He did not want American citizens to be discriminated against versus others, because at that time we did not close the borders from Europe because it was before the epidemic, except from Italy. But most European countries was open. So your Vice President Pence, asked Netanyahu, if you close the border to Americans, close it to the rest of the world too, and that's what we did. In any case, the lockdowns also started rather early. And if I will go fast forward to these days, every country in the world, including the US, and you know that New York and New Jersey are, I don't have to tell you how badly they were hit. All the countries, including Italy and Spain, who had major problems, have a Gaussian curve. You know, it's going up, the wave, and then it's going down. All the countries in the world are now on the descending part of the curve. You are still high, just starting to go down. We are at the end of the curve. Out of 128 patients that we had in our 7 COVID-19 departments and ICUs, we have now 5 patients this morning. That's why it's the past years. 5 out of 128.
Amazing.
And when opening all the lockdowns, opening the schools, opening the market, you see small additional waves. Altogether at Shaare Zedek,
So I want to make sure we hear you correctly. Although there has been an increase in Israel since the schools have been opened, you're saying it's only a small increase?
Small increase, nothing to compare with the peak, which was around Erev Pesach, when a total lockdown of the country was declared. In Leil HaSeder, people could not, elderly people celebrated Leil HaSeder. I have 17 grandchildren and 3 great-granddaughters, and the Seder I did with my wife on our own. I guess that was the situation in New York too.
Absolutely.
But the total lockdown was declared on Erev Pesach, a day before the first Chag of Pesach, and that's because we paid for Purim. Before Pesach was the peak of the wave, because during Purim, we did not have social distancing at all. The rule in Purim, which was on March 10, was that you cannot have more than 100 people under one roof. I read the Megillah in Yad Vashem, which I do for 10 years now, in the shul, in the synagogue of Yad Vashem. There were exactly 100 people there with no social distancing. So 2 to 3 weeks after Purim was the peak of the epidemic. We are now definitely not only on the descending part of but we are really flat with small waves. Instead of 15 to 30 new patients a day, it's around 100 to 120, but most of them young and no admissions to hospitals. We did not, in the last 2 weeks, we admitted 1 COVID-19 patients to Shaare Zedek, as opposed to 20, 30 a day during the peak of the epidemic. And we really are very experienced with dealing with mass disasters. As you know, Jerusalem, unfortunately, is sometimes a terror-stricken city, and explosion in a bus with 70 or 80 casualties being rushed to Shaare Zedek within half an hour is a very, very common scenario in Jerusalem, once in few years. We are also being drilled, like all other hospitals in Israel, by the IDF. And we had a drill on biological warfare a month before the epidemic broke out. So we were able, using tents outside the hospital and evacuating the peripheral departments of the hospital within 10 days to establish 100 beds for COVID-19 patients and a 12-bed ICU dedicated to COVID-19 patients where we could isolate the patients. Altogether, we treated during this epidemic 550 COVID-19 patients. We opened a biological ER. What's a biological emergency room? Anyone who came to the entrance of the hospital and his main complaint was even reminiscent of a possible COVID-19 patients, cough, fever, patients with fever, patients with sore throat, patients with loss of sense of taste and smell, were referred immediately to outside to the hospital to a biological ER where they were immediately isolated in capsules and were treated only by fully protected staff. A blood test was taken. We were able to create our own laboratory and to come up with the result within 4 to 8 hours. If they were positive, they were admitted to one of the 7 COVID-19 departments. If they were negative, they were transferred to the regular emergency room. And there were days where we had 100, 120 such patients, 1/3 of them being positive for COVID-19. At no time during this epidemic, our resources were overwhelmed. To give you an example, we have at Shaare Zedek 120 respirators. At the peak, we used 45 of them. So we definitely had, search capacity. We did not have any problem of resources. All the physicians who worked with the COVID-19 patients volunteered to do so. We did not impose on anybody. We had more volunteers among the physicians, nurses, physiotherapists, cleaners where there is an Arab majority. We had more volunteers that we needed. And I told you one moving story. We have many such stories. Very distinguished rabbis, many of them are very elderly, were treated at Shaare Zedek. We had many patients on respirators. Again, the statistics that came out of New York is that 88% of those who needed to be ventilated died.
Yes.
The figure at Shaare Zedek is 45%. I don't know what to...
You don't know why that disparity?
Well,
no idea?
we have some idea.
What's your
It's
thought?
45% mortality among the patients with COVID-19 on respirators, as opposed to 88%, which is the number I learned from an article coming out of New York. Maybe many hospitals said less than that. One explanation is that we learned very quickly, there is a controversy among the intensive care unit specialists, how soon to put the patient on a ventilator. We endorsed a policy to do it as late as possible. We tried what we call the non-interventional artificial respiration, using all kinds of oxygen suppliers and keeping as a last resort to put the patient on a ventilator.
Why?
I believe.
Why? What was the thinking?
Because we learned that it's very difficult to ventilate patients with artificial respirators when they suffer from COVID-19. You probably heard about that. Their lungs are very sick. you have to put them in a prone position in order to have for few hours, every few hours, and this is a major undertaking, in order to have the most efficacious artificial respiration. And, it's controversial how soon to put them on ventilators. We adopted this policy. I believe this is one of the factors that led to less mortality. Another factor is that maybe the average age of our patients is younger. I'm not sure about that, but I think it may be younger, although we had patients on ventilators in their 80s, in their 70s, barely in their 90s. I don't know if you heard about
And
a
they
machine.
and they survived?
Some of them yes, some of them no. It depends on their background diseases, and it depends how badly were their lungs affected and how many other organs except the lungs were affected.
But
I'm
you
talking
had
about
people,
the kidneys, the
I
heart,
understand.
the kidney, and the liver.
Okay, but you had 80-year-olds who were on ventilators, even 90-year-olds, and some
Yes,
of them got well and left the hospital to resume a normal life?
that's correct, but not all of them. Close to 50% did, yes.
In the United States, it was really around 10%. You heard 88. There have been statements here in the
Oh,
United States.
88 mortality, 88
Yes,
died.
yes, I'm saying that in the United States, the mortality rate for those who went on respirators was around 90%. That means only 10 of 100 patients got up and went home one day. And you're telling me that a little more than 50% of Israelis that you had at your hospital who went on ventilators were one day able to get off the ventilator and also to recover and resume. And again, there are people who've said to me, Jonathan, if you have COVID-19, even if you recover, it doesn't mean you can resume the same kind of life you had before. In general, is it your sense that the patients who left Shaare Zedek Hospital were able to resume the kind of life they had before they came down with the virus?
Yeah, I'll answer your question, but before that, I want to say that this mortality rate on ventilators, around 50%, 45%, is not unique to Shaare Zedek. That's the national official
Yes,
number
I do understand
in,
that.
in Israel in general. So I don't want people to understand that we are, doing miracles at Shaare Zedek.
Yes, but
It's the national statistic.
it sounds to me like the state of Israel, in your medicine, your practice of medicine, something was different than the practice has been here in the United States. And that's why I'm interested to hear what you think the real reason is that you had that fewer people had to go on ventilators. And you say one of the things you think Israel did differently from other countries, maybe including the United States, was that you waited longer to put someone on a ventilator. And
Using other modalities. There is a small machine that everybody knows in the States called OptiFlow, where you can give under pressure without intubating the patient.
but
We use this model.
why wouldn't Americans, doctors and hospitals use that also?
I cannot tell you. Maybe they did. I don't know, but I think I learned from the literature that we took it to more extreme. We put the patients with non-invasive ventilation in the prone position for prolonged periods, which helped us to oxygenate them.
And I'm sorry,
Now,
what does
as
prone mean?
prone is on the belly instead of on the back.
Aha.
As to your other question, I think these patients need a long period of rehabilitation before they resume their usual health lifestyle. But as we already have patients who are a couple of months after discharge, and we follow them in our lung rehabilitation institute, in our general rehabilitation unit, they are making very nice progress. If they come back to their baseline, depends on how badly they were affected before the COVID-19. Someone who had severe congestive heart failure or severe emphysema from smoking, and he had another insult on his lung from the COVID-19 has less chance to go back to his baseline. But most of them, if they cooperate in the long rehab period, most of them will go back to their baseline.
Okay.
And I have seen many cases like that.
Okay. Jonathan, as you and I now speak, Israel has lost around 300 patients. There's 300 fatalities. Even if you adjust that number for the discrepancy in population between the United States and Israel, it is a fraction, even when you adjust the number for the number of people who died here in America. And in some way you've addressed this, but I want you to, I am struck by the degree of success Israel had. In part, I think it has to do with demographics and has to do with population density. But it also says something about the Israeli medical system, it seems to me, and the system in general, and maybe about the way in which the Israeli people embraced whatever the rules were that were imposed upon them. But do you have anything to say about the disparity? Again, even adjusting for population size, Israel having only roughly 300 fatalities is extraordinary to me. Any comment?
Yes. Well, there are a few explanations to that, and maybe I will use as an example. I will, take my evidence far away, not to the US, but to Sweden. Sweden declared at the beginning of the epidemic that they will do no lockdowns, but only the high-risk group, the elderly and those with chronic diseases, they will be in quarantine, and all the rest, there will be, regular, the educational system. Now, Sweden has a population similar to Israel. We have 9.2 million. Sweden has 10.5. Sweden has 15 times the number of casualties of deaths than Israel. That shows you the importance of the quarantine and the lockdowns.
Yes.
And how early they are done, and they were done earlier. The closure of the borders and the lockdowns were done earlier in Israel than in your country. I'm not sure that our people are more disciplined than the Americans. It's true that the average age of Israelis is younger than in the US. About the healthcare system, I want to tell you that one of my board members sent me every day the daily address, written address of Dr. Craig Smith, who was in charge at Columbia Presbyterian in the Upper West Side in New York for preparation and dealing with COVID-19. And as much as I take great pride in our healthcare system, in its availability for every citizen, I think the way Columbia Presbyterian conducted themselves is enviable. Professionally, the volunteers that went there, the spirit in the hospital. So with all my pride in the Israeli healthcare system, and although during peacetime, non-COVID-19, there is no doubt that the average Israeli citizen is getting much better primary care and secondary care than the American patients. If we are talking about tertiary care, that's the hospitals. Those who are insured in America, they do not get inferior treatment than Israelis. Those that are not insured and get only major emergency care are definitely inferior. But it's hard for me to believe that what the hospitals in Israel could do for the COVID-19 patients, New York hospital could not do. So I would not be pompous about that. I think the main reason is, first of all, Israel is more isolated than the US. It's easier. If you close Ben Gurion Airport, you don't have a single passenger who is coming to Israel.
Right.
And look at the number of international airports that you have,
Yes.
not only across your huge country, but even in the tri-state area.
Yes.
So many. The minute that we closed Ben Gurion, we did not have an import of a single patient. And we did it very early. And I ascribe the success to that, to the early lockdowns, and to our healthcare system.
Okay. By the way, you obviously are a fan of the lockdown. I know, Jonathan, you've seen the mass protests that are going on throughout America in the aftermath of the murder of George Floyd. American streets are filled. Thousands of people are protesting. Much of what we were told by Dr. Fauci and experts at the CDC and the World Health Organization, they've gone right out the window during these protests. We were told that after washing our hands and keeping our hands out of our mouth, nose, and eyes, the most critical thing we had to do was social distance, to stay at least 6 feet away from anybody else, that we couldn't shake hands, we couldn't hug anybody, and that we shouldn't congregate in groups, certainly not more than 10 people, so that we couldn't even attend a loved one's funeral here in the United States. And now all these rules have just flown away. My question for you, based on all of your understanding of and experience with the coronavirus, do you expect a serious resurgence of the disease in the United States? And what in the world will it mean to you, Jonathan, if there is no resurgence after all of these thousands of people gathered together in the streets of major cities across the country?
So the answer is quite complicated. I believe, first of all, I listen to Fauci almost on a daily basis because I think he's the greatest expert in the world in virology and on this infection. And I know that you also appreciate what he says. One cannot underestimate the importance of social distancing. But as I described this Gaussian curve, I believe something happens with this virus that after it contracts the population for a couple of months, it tends to extinguish itself, but not completely, not completely. And if we will have a second wave, and the magnitude of this wave is dependent on social distancing. So maybe, and that's what we are seeing in Israel now. We got really down to a couple of patients a day, and after opening the schools where you cannot keep social distancing meticulously, you cannot tell second graders or first graders when they came out of the class, definitely kindergarten, stay 6 feet from each other.
Yes.
Or definitely to wear the masks. Kindergarten children cannot wear the mask. And for a second or third grader to sit 4 or 5 hours in the class with a mask is almost a mission impossible. And we see the small waves. The $1 million question or the $64 million question is, will there be a wave like the original one? I'm among those, and this is not a scientific statement. It's a feeling, and it's trying to deduct from what I see in every country, the curve in every country. I believe that definitely before the winter, during the summer, and nobody knows the real impact of heat and warm weather on the virus. But I believe that in your country too, although one should not stop to preach for social distancing, because there are more obedient people who keep it, although the streets in Tel Aviv are also, you don't see many masks, I believe that the secondary waves will be much, much smaller.
Okay.
What will happen in the next winter when there will be the flu epidemic? Will the corona be with us? We don't know. That's the $64 million question.
Okay.
We don't know. The vaccine will be the only definitive, answer to this virus. Will we have a vaccine before the coming winter in 5 months?
Will we?
Most specialists think the answer is negative. But I know that the best laboratories in the world are working on the vaccine, and maybe we'll be surprised and we'll have it not within a year, but within 6 months.
Very interesting. By the way, on a personal note, in some way, you have to be responsible for my health because it was you and your hospital that gave me the ability to continue living and doing and being as active as I am. But I have a number of underlying health conditions, and most people my age have something going on with them, Jonathan. So I'm saying to you, I see out in the world right now, all these people, they're wearing masks, most of them, but they're not social distancing. People are going out now to restaurants and eating outdoors. And I know I don't want to get this virus. I would be one of those seriously at risk if I were to get the virus. My wife would be seriously at risk. So I'm being extra careful. I'm not going out. I rarely am with anybody outside of my wife. I want to know, Jonathan Halevy, what is your advice for me in terms of my re-entering society as America unlocks? You're the only doctor I've asked, by the way, and I'm asking you on national television.
First of all, I wish you and your wife and all your beloved ones to stay healthy. One cannot overestimate the importance of social distancing. And I think, although you live in a democratic country and I live in a democratic country, and you cannot send policemen to people and ask them or really punish them. In Israel, there are fines of 500 shekels if you don't wear the mask in public spaces. And of course, sports and stadiums were not opened yet. Universities were not opened yet. All the other educational system was open. So on the one hand, I'll get to your personal question in a minute, but one has to understand that prolonged lockdowns and quarantines have their impact on health too. And it's a severe impact. Whether people, with suicide, depression, after PTSD, post-traumatic stress disorder, after losing their businesses, or direct impact on health, of seclusion of elderly people, not seeing the family. So, the market, the public space has to be open, but one cannot overestimate the social distancing. So my specific advice to you as someone who is at high risk is not to stay in quarantine, but definitely you should keep social distancing very meticulously. Don't go where there are big crowds. I would not go to a restaurant, although the restaurants opened in Israel too. They are supposed to be particular about 6 feet apart, but they are not. You cannot eat wearing the mask. So there is no way to keep social distancing in a restaurant. So don't go to a restaurant. But you can definitely see your children and grandchildren keeping social distancing while seeing them. I would not lock myself at home because it's bad for you and your wife, and it's bad for children and grandchildren not to see you. So keep social distancing yourself. If you ask me, I go on Fifth Avenue and most are not with mask. You go with your mask and don't go into really dense crowds. That's my advice.
That is so lovely of you to give me your advice, and I will follow it as I've always followed your advice. By the way, what's Shaare Zedek Hospital done with hydroxychloroquine? Have you used it at Shaare Zedek?
Yeah. So I will start with the general answer and they answer specifically, like for most of your questions. It's amazing that with our research abilities, when I say our, I mean the Western world, it's America, it's Israel, 6 months after the virus first appeared in mid-December in China, and after more than 7 million patients, there is more that we don't know about the virus than we do know.
Yes.
That's really amazing. I mean, even a simple answer, if you had the disease, are you immune and protected or no? So I will quote Dr. Anthony Fauci, who said we do not have evidence that the antibody is developing and that can be detected in serological testing are protective. But on the other hand, we have no reason to think that this virus is different than all other similar viruses who do confer immunity when patients recover from the disease. So we have to assume what we haven't proven yet. The same is true for medications. From all the medications that were researched on these 7 million people, and there are multitude of studies, and the scientific journals are less particular about peer reviews today because they want to gather quickly information about the virus. We still don't have a single medication with well-proven efficacy. The famous remdesivir produced by Gilead, maybe, we don't know even that. Hydroxychloroquine, we definitely at the beginning of the epidemic, we gave it to all our patients. We saw few side effects, mainly arrhythmias, rhythm disturbances of the heart, but very few. We did not lose a single patient. But when the data accumulated, that its efficacy is totally unproven and it's probably not efficacious at all, we stopped giving it. And we use the supportive care that is usual for these patients to oxygenate them very well, non-invasively or invasively, to keep the fluid and the electrolyte balance of the body perfect in order to protect the kidneys and the liver. And that's what we did, to give them antibiotics if they have secondary infections, but none of the medications, not the chloroquine, not the hydroxychloroquine, not the vitamin C, not the vitamin D, and many, many others. There was the ritonavir and lopinavir, the anti-HIV medications that were used for a while. They all were proven on large series of patients as totally non-efficacious. And we stopped giving them in the middle of this epidemic.
I have one last question about how Shaare Zedek dealt with patients. And this concerns me as a rabbi and as a Jew. Very often people ended up dying alone, and they were denied the opportunity. Families were denied the opportunity by hospitals to come and see their loved one at the end of their life. And I don't know that it was the right thing. And I don't know that hospitals shouldn't have developed some kind of practice where if a family member said, "I'll wear any kind of gear you want me to wear, I'll follow all the kind of procedures you as doctors and nurses are following," that they should not have access to people they love who are very, very ill, either are dying or who are at risk of dying. I mean, one of the most terrible things about this disease is that people have been forced to die alone. It contravenes every Jewish value we know. And I'm wondering how you, as a committed Jew and as such a caring doctor and caring person, what's your feeling about that practice? And in retrospect, as you look back at it, would you have wanted Shaare Zedek to have a more open policy when it comes to letting family members, maybe one, two, see a loved one at the end of their life?
So first of all, I'll take this opportunity towards the end of the interview to thank you for the excellent questions that really enable me to put forward almost everything what we did. And we were, of course, sensitive to what you raised, that this was maybe the most sad scenario, to see an elderly patient not being approached by the family during the last few days of his life. And we acted about that, and we suggested to the families, and it all depends. If the relative was high risk, we did few things. First of all, if there was a younger sick patient in the family, we enable, and although he was mildly sick or moderately sick and did not have to come to the hospital, we suggested to them if they want to join their beloved elderly one in the COVID-19 department, we would admit them, and we had 8 such cases. A very famous rabbi in Israel, whose name, of course, I will not mention, was joined by his 45, he was in his 80s, he was joined by his 50-year-old son, who was much milder symptom, had much milder symptoms, and they spent, he recovered, the rabbi also recovered, but they spent a week together. And we had such similar cases to people who did not make it, including, again, another famous rabbi who was even the chief rabbi of Israel in the past. And he expired in the company of his son, who was also sick. To healthy patients who were not COVID-19, we told the relatives that they have 3 options. Either to communicate from home, like we did during this Shabbat, my story, or to come to the area, the headquarters of the department, where they could communicate through the camera directly with the patient. And if the patient had a relative, especially children, who did not have risk factors, who were in their 40s or 50s, or even early 60s with no background diseases, and they insisted on wearing the fully protective equipment, these white suits, we enabled them to do that and to go in and to say goodbye.
Good for you. Good for you. By the way, anybody in your hospital, doctors, nurses, come down with the disease?
Yes, we did have. First of all, at the peak, now we have 1 sick physician who was not infected in the hospital. We traced the infection to an imported case, and we have 7 members of the personnel of Shaare Zedek in quarantine because they were in the vicinity of infected patients. We do tests to our staff in order to see that every few days, to see that they are not carriers, they are not infected. We are very particular about not allowing staff with symptoms to come to the hospital. Even if there is slight fever, of course, we check the temperature at the entrance, but they do not come to work with symptoms. Altogether, we had about 19 members of the staff that were infected. Only 2 of them were traced to be infected in the departments and not in the COVID-19 departments.
Okay.
It was in the geriatric department where a patient was found to be positive after being admitted, not for COVID-19.
I understand. Did all of them survive?
Yes.
Okay, very, very good. Bottom line, Jonathan, do you feel we're coming out of this virus, or is it a lull and we're going to be dealing with it again?
I believe we are coming out. But I'm naturally optimistic, and also looking at these famous curves, I believe we are out. But if we will have further waves, and the magnitude of the waves will be dictated on our discipline, keeping social distancing, which will be with us for a prolonged period. I can't tell you if prolonged period is 6 months, 1 year, or 2 years, but social distancing will be with us. Going back to usual life will bring back, I don't know if a huge wave like the original ones, with your, 120,000 almost casualties in your huge country, unfortunately. And you mentioned before, we have 300. The difference in the population is 40 times. We are 9 million, so you are 330, 340. If you multiple 300 by 40, you get to 12,000, not to 100,000, not to 120,000. So I believe the magnitude of resurgence will be dictated by our social distancing, by our mutual protection of each other, what we call the arvut hadadit, Israel arevim ze laze. We have to vouch for each other. And I believe that in public spaces, people should go with masks. Definitely in the next few months, I'm not sure that not in the next year or two. And I believe that the original wave that we saw, really with so many victims in the US, in Italy, in Spain, I believe it will not come back in this magnitude. Something will happen to the virus, but I believe that Professor Anthony Fauci would give you a more reliable scientific answer if really this virus is undergoing mutations and will eliminate itself eventually. I believe that's what's going to happen.
It's not just that I have the highest regard for you. I love you very much. You're a very special person. You're a fabulous doctor. What you've done at Shaare Zedek, and I understand, you have an entire staff. You didn't do this alone. But like everything else in life, it comes from the top and leadership. And what you've done, not simply for Shaare Zedek, but what you've done for the state of Israel in creating a haven on so many levels, the least of which and the most of which help people medically and socially and in terms of the tone of Israel. So, again, Yasher Koach to you in every degree. It is so lovely that you would come. It was a kick for me to be able to spend this much time with you talking about some very important issues called Tuvu Hatzlacha for you, your staff, and for your family. All of you should stay safe and be well. And you and I should get together again when this whole nonsense is over. But thank you, my dear friend. Thank you very, very much.
Not at all. It was my pleasure. Thank you very much, Rabbi Golob, and the same to you and all your beloved ones. Stay safe and healthy, and thank you for this unusual interview with excellent questions. I'm being interviewed on Israeli TV almost every day. I had 2 phone calls for Israeli channels during this, that's my phone, during this interview. Nobody asked me so many excellent questions. So, kol hakavod to you too.
Thank you. We'll talk again soon, my friend. You be well.
Be well. Bye-bye.
Bye-bye.
Thanks.
The thoughts of Jonanthan Halevy, the former Director General and now President of Shaare Zedek Medical Center in Jerusalem. I'm glad I could introduce him to you. He is, again, a brilliant physician and a most wonderful human being. Until the next time, I'm Mark Golub. Stay safe and be well, my friends.
We would be pleased to send a complimentary DVD of this program to anyone who wishes to support JBS with a tax-deductible gift of $36, double chai or more. Simply visit the JBS website at jbstv.org and click on the Donate button to make a donation by PayPal or your credit card. And please indicate the program for which you would like a DVD. Or you can send your tax-deductible check to JBS, Post Office Box 360, Stamford, Connecticut 06904. Or you can call the JBS Pledge Line at 833-MY-JBS-TV. That's 833-695-2788. And again, please remember to indicate which program you would like to receive with our compliments. We thank you for your kind support.